Hi everyone, my name's Graham and I'll be doing the Blood Results Made Easy Lunch and Learn training. The aim of the Lunch and Learn events are short, focused 45 minutes of CPD. They can be as interactive as you want them to be. So if you just want to sit back, have your lunch and listen, it's completely fine. But if you want to have an opportunity to ask questions, share thoughts and ideas, that's the aim of the session as well. And you'll get a 1 hour CPD certificate. For all of the training that we do at Blood Results Made Easy, the main learning outcome is to link everything back to the underlying anatomy and physiology. So we'll have a look at what the protocol says, what the NICE guidance says, or what your national guidance says, but then also how that links back to the underlying anatomy and physiology. So the aim of these are small building blocks of learning, which you might use to progress into a full 2-day course that we offer, or into further learning and trainee roles. So having done lots of training in lots of different settings, we thought it'd be helpful to break the learn and lunch topics into how to read the results, anemia and iron, vitamin B12, iron ore and warfarin, lipid management, liver function, kidney function, HbA1c and diabetes, CRP and inflammation, thyroid function, delirium and confusion, and osmolarity. So the idea is you can kind of dip in, you can choose one that you like, or you can do all of them. We've only got 45 minutes, so it's going to be the key overview markers for relative clinical practice. We also do this training over 1 or 2 days. So we do training for beginner's guide, so ideal for HCAs. We also do blood testing in the following settings, so long-term conditions, chronic disease management, advanced clinical practice, cancer care, palliative care. We've done a lot of work on eating disorders and dietetics. We've done a lot of work on physiotherapy, particularly things like first contact roles, mobilizing patients, mental health. And we've also done work with colleagues around urgent treatment, rapid response, SDEC, intermediary, A&E, community, sort of keeping people out of hospital. We also do basic ECG interpretation, medical terminology, and we also have a session on how to create a good quality interactive teaching session. So in all of the training that we do, there won't be any AI scripts. There'll be lots of understanding around different learning needs, different opportunities to reflect, do some visual learning, do some practical learning, and do some written learning. So all of our training can be delivered online via Teams or Zoom. We can come to you directly and deliver that in-house or face-to-face. And we also have an e-learning on-demand system, so you can review this material as an e-learning package. And what we found very helpful is we can also split all of this material into specific small sections, like we've done with the Lunch and Learn. But if your workload needs, maybe you would like a 2-hour session every couple of months on a particular topic, we can build that in and we can work with you. So if you want any more information, then scan the QR code and that will take you to our website. So as an example of the Lunch and Learn iron, so you can see a flavour of what we're going to talk about. It lasts about 45 minutes. It's a very informal conversation. And for all of our sessions, we'll always say that it's not medical advice and that your local guidance will take precedent over anything that we're going to talk about specifically. So for the Lunch and Learn iron one, for example, we'll do an overview of blood tests to help with diagnosing and managing iron deficient anemia in clinical practice. So we'll have a look at what is anemia, what are the symptoms and presentation, what are the key blood tests and what do they mean? So we'll demystify some of these abbreviations. We'll have a look at the impact of infection and chronic conditions, particularly on something called ferritin. And we'll also have a look at red flags, index of suspicion, make sure we've missed anything like a GI bleed. And most importantly, why some of the patient's results don't match. So there are actually 3 different types of iron conditions in our body, and not all of them have low hemoglobin or low ferritin, for example. So we'll explore that in more detail. Throughout all of the training, we go back to the underlying anatomy and physiology. So we'll have a look at how far out of range is the result. Have you got any clinical approved guidance around that? Does the result make sense? Are they symptomatic? Have they had a new drug started? Is it always out of range for them? Third question is linking markers together. This is really important. So let's define what ferritin is and what hemoglobin is. And then can we start to link these together a little bit? So, okay, they've got normal hemoglobin, but they've got a low ferritin. Why would that be? So the aim is to go back to the underlying anatomy and physiology. You can easily find protocols. You can ask AI. The aim of our training is to have that link back to the knowledge you've already got around anatomy and physiology. And then finally, why did you do a blood test on them in the first place? If they were very tired, there might be other reasons for their tiredness. They might have low sodium. They might have a problem with the thyroid gland, for example. So you will have a look at treating the person rather than the numbers. So as an example, we'll have a look at diagnosing anemia, and we'll quickly review this. Given the lunch and learn on iron as an example of kind of what you're going to get, will be this side. So we're looking at low hemoglobin. Low mean cell volume. So we'll explain all what hemoglobin is, what mean cell volume is, and we'll have an opportunity to reflect on how to diagnose anemia. And then we'll have a look at microcytic. So these are small red blood cells, and they're normally due to an iron problem. So we'll explore all of that. The most important bit of the session is actually to reflect on iron does 3 different things in our body. It absolutely helps with red cell production. So if that's low, this is called iron deficient anemia. Classic, low hemoglobin, low ferritin. However, iron is also really important in inflammation. So if you have an inflammatory condition, like an infection or a long-term condition, that can change iron levels. So inflammation can start to affect ferritin levels. So now ferritin no longer reflects iron storage. Instead, it reflects inflammation. And finally, iron has a specific role to give us energy. So your person might be feeling really tired all the time, not because of anemia, but because of a lack of iron for energy. This is called iron deficiency without anemia. So these have some odd results. These have normal hemoglobin, but a low ferritin. So we'll explore all why that is, what that looks like. So at this level, we're going to do hemoglobin and ferritin. It will be helpful to have an extra marker. So that's when we would look at something called iron studies. And there's a really helpful iron studies marker called TSAT, which all sounds very complicated, but we'll break it down into simple terms. TSAT is effectively a minibus that's going to deliver iron for red cell production. So we'll have a look at how full or empty your person's minibus is. So iron studies can then help to determine whether somebody gets iron tablets or whether they get an iron infusion. And in all of the sessions, just to finish off in terms of different delivery models, there'll be a little quiz. So for example, you might want to pause this video and have a look at this one. Which blood test is most commonly used to assess iron storage? And the answer to that is ferritin. Ferritin is stored iron. Question number 2, what ferritin level would suggest an iron deficiency? So we'll talk all about that in the session. And yeah, normally less than 30 micrograms per litre. And we'll also have an opportunity to put that into case studies. So I've got a couple of case studies for each lunch and learn. For the iron deficient one, we've got a few. So for example, Sarah works full-time as a TA in a school, 34, recently started a vegetarian diet over the last few months. 2 children, regular but heavy menstrual bleeds, not on any medication, no previous medical history, and 3 months of increasing tiredness. So we'll have a look at the blood results and we'll have a look at what type of anemia Sarah might have. So all of this stuff is linked directly to clinical practice. So hopefully that has helped outline a little bit around what we do and the purpose of the Lunch and Learn sessions. You can have a look at our website for more information and hopefully see you soon at one of our sessions.